In a country where only 15% of the population, say, is covered by some form of health insurance, what is it that we are going to do, that we have to do to be able to increase that pool?
Yeah, absolutely right. In the sense that, right in the earlier in the conversation, you talked about out-of-pocket spend, and that's a huge number. 75% of out-of-pocket spend is probably the highest in the world, and we do have a problem. And the main reason at this point of time in India is in health insurance, and it's at a level at which it is at this point of time. It's because it's been unprofitable. The pool of insurance funds is largely, if I may say so, a pool from a set of people who have felt the urgent need either by themselves, their families, or their friends. So they're the people who are buying insurance. But that's a pool which is high frequency and high cost. And hence it becomes unprofitable for the health insurance sector. Now the real equation should be, the pool should be a pool of money from the healthy and the not so healthy, and that makes it bigger and wider. Now to reach that stage, there are several things which need to happen. We've made an entry as a private sector specialist health insurance company, and I do believe the regulations should invite more applicants who will be focused on the sector, who are doing this from 9 to 6 and nothing but this, so that we understand we're able to produce products and we're able to contribute towards the ANS. So I think there is a role for the regulator to play in terms of having specific health insurance regulations and rules and entries and barriers to make sure that the right sort of players come in. There is a role for the government at large to play, again, to help promote the awareness and what healthcare costs are and what healthcare costs are likely to be, and how financing through insurance is an absolute must. There is a big role for us as insurance industry to play in terms of our branding and product innovation and on our service levels. And I think there is a big role for the healthcare providers to play in terms of standardization of processes, rates. So I think there are different stakeholders, and each of us have a very important role to play to raise that 150 million, the 15% you talked about, to the 400 million. And I can see that happening because we're doing a lot of things. There is a lot of government programs, the RSBY, which is for below the poverty line, which is, they're doing a great job. Private sector has been encouraged. New players like us are coming in as a specialist licensed player. So there are a few things happening, but I do hope those numbers will increase.
Provided, of course, we see some changes in legislation, in regulations, and more investment coming in into the healthcare segment here. That's all the time we have. Thanks.